Welcome to the Best Family on the Block podcast, where a mother and her two daughters talk about love, life, and everything in between. Episode 4, Birth Stories. This week, my recommendation is going to be Down to Earth with Zac Efron. And the other co-host, his name is Darren Olian, I think is his last name. And it's definitely an informative show, not a typical show you would think to see Zac Efron with. It was really cool to see them kind of dive into the world of sustainable living and just different ways that different countries live their lives or different people live their lives choosing to be sustainable, like just from using their land more purposefully and using energy more purposefully. It was a really cool show. Definitely would recommend.
Want to go live off the grid somewhere?
Yes and no. Austin and I were talking about like if we had ever like bought a farm one day and decided to live off the land. But him and I are so social that I wouldn't want to live far away from people, and I wouldn't want to have to make people drive to come to our house.
Yeah.
But
I wouldn't mind living on like a piece of land of about, 5-ish acres.
Yeah.
Not too far from the city. I need my HEB, but 5
For
acres
those of you
sounds
that
nice.
don't know, HEB is a grocery store here in Texas.
It's the best one. It's the only one where I live right now. It's either Walmart or HEB.
Right?
I know a lot of other places have Kroger, but we don't have Kroger, which I'm okay with.
You don't?
I don't. Yeah, we don't have Kroger here. It's weird.
My recommendation for this week is I was watching a show on Netflix called Outer Banks. I thought I wouldn't like it because it's about a group of teenagers living in the Outer Banks of North Carolina. And the premise of the show is the main character's dad is missing, and he went missing looking for hidden treasure, hidden gold. And so the whole show is about these kids trying to find their dad / the gold. Mm-hmm. And it follows their adventures. It's not a comedy, it's a drama for sure. But it's kind of, I don't know, I enjoyed it. I didn't think I would.
I didn't think I would enjoy it either. When I first saw the trailer for it, I was like, oh, this is going to be some stupid teeny bopper drama.
I thought it was going to be like major drama, teenage drama.
But then I watched it and I was like, oh, okay, I like this. I'm excited for whenever season 2 comes out.
Not every teenage show is like Riverdale.
Yeah.
Well, fortunately, then I've never seen Riverdale.
You don't want to.
Yeah.
Well, some people like Riverdale, but
it's a little too much for me.
Very dramatic,
it's like a teenage soap opera,
right? And Outer Banks is not like a typical soap opera type. I mean, there's a lot of intricacies and different relationship dramas going on, but the main focus of the storyline is them trying to find this treasure, and it's about, they call it the Pogues and the Kooks, and the Pogues are the poor people that live and work in the Outer Banks area, and then the Kooks are the rich kids. So there's that whole dynamic. If you are listening to this and you're more of my age, it has a little bit of like a Goonies kind of aspect of to a certain degree. Kids finding treasure. So yeah.
Millennials know what Goonies are.
Yeah.
It was good.
Yeah, we saw Goonies.
Sorry. So I don't know what kids watch today.
Well, kids today and millennials are not the same thing. Kids today are Gen Z, and
it's definitely like if the Goonies had taken place in high school
instead
of middle school or elementary, however old the kids were in the Goonies.
Yeah.
So my recommendation this week is not a TV show because I've been watching nonstop anime recently, and I highly doubt any of you want to listen to that. Unless you do, then that'd be great. I could be your anime recommendation person. I'd be okay with that. But right now, my recommendation is to go to Sonic and to get a cherry limeade and add the watermelon Red Bull that they have right now, because it is amazing. And I know the watermelon Red Bull is limited edition right now. So you could just buy your own Red Bull. I recommend I think it's cranberry. It's in the red can. And add that because it's really delicious and
Can you
amazing.
get the Red Bull at Sonic?
Yeah, they have regular Red Bull and watermelon Red Bull for a limited time during the summer.
I didn't know that.
Yeah, it's delicious and amazing. You can get they have a slush of it too. Though like they have a Red Bull drink that they have as a slush.
So I just don't like lime. I don't like limeades.
Oh, I love it. Like my next plan is to buy my own like cherry syrup so that I can make my own cherry limeades at home because I may or may not have spent a little too much on them recently.
What's the main, is it like soda water and then they add cherry?
No, it's Sprite. So it's cherry syrup, Sprite,
and lime juice.
And then limes. Yeah. I think they use real lime wedges that they add to make it limey, but it's really good.
Interesting. I'm not a big fan of flavored drinks, so
I really like flavored
drinks. You don't even drink
like
soda.
No.
Yeah.
No, I don't.
Like my favorite thing to drink is the ultra red Monster energy drink because it's 0 calories and it tastes like the flavor red.
It tastes like the flavor red?
So it doesn't have a distinctive like fruit or like candy flavor or anything like that. The only way to describe it is it tastes like red.
Okay, so Austin and I were watching this video from Good Mythical Morning, and if you've ever seen them with Rhett and Link.
Yeah, I see them on Facebook sometimes.
And they did this episode where they talked about, does your brain actually think that flavors are certain colors, or do you associate colors with certain flavors? So they had like a span of different colored drinks in front of them, and they had to drink them and tell them what flavor they thought it was based on what it tasted like and the color that it was. And so they were purposely trying to throw them off on the flavor and color. So like red, you think of like strawberry, cherry. Blue, you think of raspberry for some reason.
Because blue raspberry.
Right. Green, you think of like green apple. And so they were trying to get them to like change what they thought the flavors were. And so it was really interesting to see what colors they associated with what drinks.
I don't know what other flavor you could associate with orange, though.
Citrus.
Mm-hmm. Anything citrus or, I don't know.
I wouldn't associate lemonade with orange. You think lemonade, you think yellow.
Yeah.
That is interesting. So today's podcast, like we had said earlier, is going to focus on birth stories, specifically my birth stories in when I had Luaranne and Morgan. And the reason we wanted to focus on those stories is my birth stories are a little bit unique and maybe not for the faint of heart. So if you are pregnant and or wanting to have children
and are extremely anxious and have lots of anxiety,
yes, be forewarned that
this may not be the podcast
not
for you.
your typical birth stories. And more than likely, you will have a wonderful pregnancy and childbirth experience.
This is just like worst case scenario.
Well,
I don't know, worst case scenario, but just not typical. So when Daddy and I got married, your dad, I wanted to have children like right away. If it was up to me, I would have gotten pregnant like on our honeymoon. Dad was a little bit more pragmatic and realized that, maybe that's not the best thing. Let's wait a little while.
Mm-hmm.
And so finally, I guess we were married for maybe about 8 months when I got pregnant, and I was 23. So I got married when I was 22 and I got pregnant when I was 23.
You got pregnant in April?
I guess. So I was on birth control pills and I went off the birth control pills, and the doctors were like, it's going to take about 3 months for your body to get back to normal. And I was pregnant 2 weeks after I went off the pills. So when I didn't get my period that first month, I thought it was just my body kind of coming back to normal from being on the pill, which is what the
Right.
doctors had told me.
Right.
They said you may not get a period that first month. So I didn't think anything of it. And I kept feeling like I was going to get my period. I had the cramping and all that stuff. And
I was going to say that this is also kind of a story of you can get pregnant at any time. So please be prepared and cautious about that. Because you can get pregnant at any time.
right, exactly. And we were actually at a friend's house for Memorial Day weekend, and it was actually Memorial Day, and I was telling her about my symptoms, and she's like, I think you're pregnant. And I'm like, no, I'm not pregnant. Trust me, I would know. And she's like, no, I think you're pregnant. Let's go get a pregnancy test. Well, it was Memorial Day and everything was closed except for, I think, the local like CVS or something. So we went and got a home pregnancy test, and I took it the next morning, and sure enough, I was pregnant. So my pregnancy started out normal. I guess normal. I was deathly ill. Got sick every single day. And
yeah, not just morning sickness, all day sickness.
Yeah, it was brutal. And from the time I was about 4 months pregnant, like I couldn't wear my rings. I was swollen all the time. I just was uncomfortable. And right at about the time I was 30, maybe 30 or 31 weeks pregnant, I went to the doctor for my normal checkup. We had signed up to take Lamaze. We hadn't started taking Lamaze yet, but we had signed up. We were getting close. And fortunately, so I was due January 31st, and this was November, and my family decided to have my baby shower in November rather than in December or the beginning of January, because they thought, you know, with the holidays coming up, it would be easier to do it before all the holidays came so that, you know, people wouldn't be stressed, you know, after the holidays trying to do a baby shower. So fortunately, I had my baby shower early in November because I went to the doctor, and it was towards the end of November and actually beginning of December. And they were like, you don't look so good. And oddly enough, it was funny because so I went to the doctor on a Monday. That Sunday before, I was in church, and I was in the nursery because your dad and I worked in the nursery, and a lady came up to me and she says, "Are you okay?" She says, "You don't look good." And I was like, "Yeah, I'm tired. I didn't sleep good last night." And she says, "Okay, because you know, you look really tired. Like you don't look so good." Went to the doctor on Monday. And they were like, "You know what? You have a little bit of protein in your urine, which is a symptom of preeclampsia," which I did not know at the time. And they said, "Why don't you come back on Wednesday, and we want to check you again and see if and my blood pressure was slightly elevated." So I was like, okay, didn't think anything of it. Well, on Wednesday, Dad came with me to the doctor's appointment because they were checking for something, you know, and I just was nervous and I wanted Dad there. And again, my blood pressure was more elevated now. I had protein in my urine, and I had gained 4 pounds in 2 days.
Whoa.
And all of those symptoms combined are the symptoms that they look for when they are looking for preeclampsia. So the doctor was like, you know, she has preeclampsia, and we want to put her in the hospital so that we can monitor her. And I was very, very nervous. I didn't know what was going on. I'd never experienced anything like this before. It was our first baby. And your dad, being his typical self, says to the doctor, he says, "Well, I just want to know, are we going to get a tax break this year? Because you weren't due until January, which means we wouldn't have been able to claim you on our taxes for that year." So he thought, okay, maybe we can claim her. But anyway, so they put me in the hospital. Again, I didn't know anything. And they put me in the hospital, and got sicker
Mm-hmm.
and sicker and sicker. My kidneys started shutting down. And so they moved me from that hospital to another hospital because they realized that Luaranne was going to be born early.
Mm-hmm.
And so they wanted me in a hospital that had a better NICU, which is a neonatal intensive care unit. So they transferred me to another hospital, and probably within 24 to 48 hours of transferring to that hospital, I guess my symptoms got so bad that they were like, okay, we're going to have to induce you. She's going to have to be born early.
Mm-hmm.
And so they induced me. It was a Sunday. Again, I had no idea what inducing meant. I didn't know anything about it.
I was going to say,
And
you
so,
were also like the first of most of your friends to have children, and the first out of dad's sisters to have children. And so, I mean, and there wasn't just, you couldn't just pick up your phone and Google what was wrong with you.
right, we didn't have
I
cell phones
thought that
back
they
then.
never told you that you had preeclampsia. I thought they just kept you in the dark the entire time.
No, they told me what preeclampsia was, but I didn't understand
They
what it
didn't
was.
tell you the severity of what it was.
Right. They just were like, we need to watch you. And again, this is before the days of
This is the 90s.
cell phones. This is before Google.
Yeah, this is
was a
early
thing.
90s.
This is early. Yeah, 93 was when you were born. And so, like, Daddy didn't even have a cell phone. He had a beeper. I think cell phones did exist, but only rich people had cell phones. And
Mhm.
clearly we were not rich. So we didn't have a cell phone. And so I called Dad, and it was a Sunday morning, and I was like, okay, they're going to induce me. And I thought, and he thought, well, that means you're going to have the baby now. Today. So he rushes to the hospital, and I ended up being in labor for 17 hours. You were born on a Monday. I was 32 weeks, and you weighed 3 pounds, 15 ounces.
Mm-hmm.
After you were born, I ended up getting sicker, and they didn't know why, or I didn't know why.
Because for most people, the only cure to preeclampsia is having the baby.
Correct. And in my case, that didn't help. And I remember when you were born, everybody was like, oh my gosh, she's a preemie. She's, we got to pray for her that she'll get through this. And then the doctors were all, well, the baby is fine. It's Paula that we're concerned about because she's not getting better. Mm-hmm. Well, the funny thing is that when this happened, the doctor that I was going to at the time, that I had been going to for years, when they transferred me to the hospital that had a better NICU unit, they dropped me as a patient and transferred my care to the doctor on call. Like, I essentially didn't have an OBGYN when I delivered Luaranne.
And that was because it was a high-risk pregnancy now, right?
It was a high-risk pregnancy, and the doctors that I had been using, they did not feel comfortable managing my care through that, because found out later that they had had a patient once before that had preeclampsia that had died, and they just didn't want to take any chances. But again, none of this was communicated to me. I didn't know anything. And Dad and I also didn't know that we could, like, we were young. I was 23. Dad was 25.
Right. The idea of like advocating for yourself in the hospital wasn't a thing.
No. And the hospital that they had transferred me to that had the better NICU was also considered a teaching hospital. Mm-hmm. So note to all of you out there, if you ever are in a teaching hospital, if you don't speak up, they will let medical students and or residents take care of you.
Right.
And I didn't know that we could say, I don't want a student, I want the attending, or I want an actual MD. So when Luaranne was born, there was an actual medical student in the delivery room giving me an episiotomy. For those of you that don't know, an episiotomy is when they cut you down there to make more room for the baby to come out. And she was 3 pounds. There was no reason to give an episiotomy to a woman having a 3-pound baby.
Right. Preterm. Yeah.
Right. So now, again, we didn't know that we could say, that's not okay. So I ended up being in the hospital for a whole nother week after you were born, until I guess I finally got better to go home. Luaranne, you ended up staying in the hospital for 3 weeks. You came home the night before New Year's Eve. So you came home December 30th, I guess. You were born on December 13th and came home on December 30th. You were supposed to be born January 31st.
Mm-hmm.
You were tiny. We brought you home. You weighed 4 pounds, 11 ounces, and you were so tiny. But you were a good baby. But so to kind of tell you, what preeclampsia is, because I had to do some research after, I didn't know. And basically, preeclampsia is a pregnancy complication characterized by high blood pressure and signs of damage to another organ system, most often the liver and the kidneys. And in my
Which is
case,
why protein presents itself in your urine, right?
I guess
because it's not being filtered through your kidneys
properly.
I guess, yeah. And
Yeah.
and in my case, it was my kidneys that had some trauma or whatever as a result. And they say that preeclampsia usually begins after 20 weeks of pregnancy. And in my case, yes, that is what happened.
Mm-hmm.
But I feel like I started to have symptoms of it early on because, as I said, by the time I was 4 months pregnant, I was swollen. I couldn't wear my rings, my face, everything was swollen. So if you don't treat preeclampsia, it can lead to serious, even fatal complications for both you and your baby. And if you have preeclampsia, they say the most effective treatment is delivery of the baby. But even after you deliver the baby, it can take some time for you to get better. So, the symptoms of preeclampsia are high blood pressure, excess protein in your urine, severe headaches, which is a lot of times caused, because your blood pressure is high.
Mm-hmm.
You can have decreased levels of platelets in your blood, which did happen to me, which I didn't know. Again, nobody told us anything.
Mm-hmm.
And I remember after you were born and I was starting to feel a little bit better, they would let me walk up and down the hallway of the hospital. And I ran into a doctor and he's like, "How are you feeling?" And I said, "Oh, I think I'm feeling a little bit better." He goes, "Yeah, we were really worried about you. Your platelet count was really low." I had no idea what that meant.
Right.
I didn't know what platelet count was. I was really naive.
For those of you that don't know, platelets are the things in your blood that help seal up wounds. They're the things that kind of like that they create blockage if there's too much of them, I think, as well, which is what leads to like certain heart attacks. There's too much platelets in your heart itself, but their main purpose is to help seal up wounds when you get cut or something.
Well, and also too, I did not have a C-section. I did have you vaginally, which I've always wondered why. Why did they not just give me a C-section? Why did they let me
Go into labor
and go through a vaginal delivery if I was that sick? Because I was so sick that when they induced me, they took the phone out of the room. They took everything out of the room, and they told myself and Daddy, they were like, "She cannot have any stress or undue stress while she's in labor, because if I got stressed, it could cause my blood pressure to spike, which could cause me to have a seizure."
Mm-hmm.
I didn't know. I knew that, I needed to try and stay as calm as possible. But again, why did they not just give me a C-section?
I wonder if, hold on.
I feel that the reason why they didn't tell you all of these things is because they might have been trying to either spare your feelings or try to keep you as calm as possible by just keeping you in the dark.
Well, I wonder if because your platelets were so low, having surgery was not an option.
And I think now that, and I didn't put those two together until years later. And I do think that maybe that is wise, because my platelet count was so low that there was a real possibility, had they cut me open,
you would have bled
I
out.
could have bled out. Now, granted, when you deliver a baby vaginally, you bleed too, but maybe there was a way, maybe they were thinking they could control that better. I don't know. I still, to this day, don't know why.
It wasn't as traumatic to your body.
I guess.
Like, having a birth vaginally isn't as traumatic to your body as having
surgery.
Yeah. So yeah, it, so the funny thing was when I got sick towards the end of my pregnancy, my parents actually happened to be in Hawaii on their wedding anniversary getaway. And of course, when they planned the trip, they planned it knowing, oh, it's November, or it was early December. She's not due till the end of January. Like, we're fine. And it was while they were in Hawaii that I got sick. And at first we were just kind of keeping them updated. This is what's going on. This is what's going on. Well, when they transferred me to the other hospital, that's when I got scared. And I was like, okay, maybe they need to come home, because I was sick. We didn't know what was going to happen to me.
Right.
And so my parents flew home from Hawaii, and it was like, it was not a pleasant flight for them. And they came straight from the airport to the hospital, and they got to the hospital the day that they induced me. And I wouldn't let them come into the room and see me, which they're still upset about to this day. And I think I didn't let them come and see me because I was afraid that if I saw them, I would start to cry, and I would get hysterical, and I would realize like how serious the situation was. And I was afraid to do that because I didn't want my blood pressure to go up any higher than it needed to be.
Which is a very valid reason.
Right. I don't know that they see it that way, because they still are like,
right. It's my child giving birth.
Right. So anyway, so you were born at 32 weeks. You weighed 3 pounds, 15 ounces when you were born. I had to leave you in the hospital when they discharged me. That was pretty upsetting. And especially, you were my first baby, and I didn't get to have that bonding moment with you. They almost didn't even let me see you after you were born. They had you in a little isolette, and they were getting ready to wheel you out. And Daddy was like, can she at least see the baby? And so they stopped, and they let me look at you, but I couldn't touch you. I didn't see you. Like, I didn't get to feel you or anything.
We think that me being born this way and being in an incubator and like no skin-to-skin contact when I was first born is why I am not a hugger. I do not like hugs.
I mean, it makes sense, because skin-to-skin contact is so important for newborns, especially with their parents. So because that's how they form that parent to child bond.
You and I both missed out on that initial bonding moment. And I didn't even actually get to see you until at least 24 hours after you were born, because they had to make sure I was stable enough. And I got to come down and see you. They wheeled me down in a wheelchair, and I got to see you, and I got to stick my hand in the isolate and touch you, but I couldn't hold you because they were still stabilizing you. I will say, because they knew you were going to be born early, they did inject me with steroids, 2 shots of steroids. And what that does is it speeds up the process of your lungs developing to give you a better chance of being able to breathe on your own when you were born. So when you were born, you did cry, and you sounded like a little teeny tiny kitten. And so I remember hearing you cry and thinking, oh, thank God, she's breathing. But they did, when you went to the NICU, they did give you oxygen just to help you, so you weren't straining to breathe. not for very long, because you were pretty strong, and
They also
you
say
stayed.
that girls fare better than.
They do. Statistically, girls fare better as premature babies than boys. Um, I don't know the science of that, but I think it's because girls are stronger than boys. Um, and you had none of the what you would consider typical premature baby um, issues. You did not have heart um, issues. You didn't have any vision issues. You wear glasses, but you probably would have worn glasses anyway because your dad wears glasses and I wear glasses. But the
I
only
didn't get
thing that
glasses until middle school.
right, exactly. The only thing that you had that is common among premature newborns is you did have uh, apnea, which is when your body stops breathing. And typically, when you have apnea, like with the newborns, you kind of just jerk them. You kind of like shake them, move them a little bit so that they remember to breathe.
Mm-hmm.
So you had all kinds of alarms on you so that that would happen, and whenever you would stop breathing, an alarm would go off and the nurse would come over and move you a little bit, and then you'd start breathing. And you developed an infection, and I don't know how, why, or what. You developed an infection and they had to have an IV, and when they first gave you the IV, it was in your arm, but then they moved the IV to your head. And the reason they had the IV in your head, they said, because with newborns, especially prematures, they wanted to have you wrapped with your arms close to your body. It's
Mm-hmm.
supposed to be comforting for you. And having the IV in your arm kept your arm straight. And so you
Mm-hmm.
couldn't bring your arm up to you. And it was,
I wonder if that also helps with like retaining body heat, keeping the arms.
no, I think it's a comfort thing for babies.
Well, yeah, they like to be.
That's
swaddled.
why when you swaddle babies, you always swaddle them with their arms close to their chest. And I guess maybe because that's how you are in utero,
Mm-hmm,
so
mm-hmm.
they want to duplicate that.
It simulates like them being in the womb, I think.
Yeah. So they put the IV in your head, and they did that because they said the blood vessels in your head are really close to the surface. It looked like it was super painful, but they said it wasn't.
I don't remember it, so.
No, well, you were teeny tiny.
There are lots of pictures, though.
Yeah, and you did have trouble eating. So they did have to tube feed you for a while. So for a while, you had a tube down your mouth into your tummy. You would exert so much energy sucking on a bottle that you would actually lose weight. So they wanted to give you some time to kind of bulk up a little bit before they reintroduced the bottle to you.
So even though like the OBGYN side of the experience wasn't that great, it sounds like the NICU really, they did well. They did their job.
Oh, they were fabulous. The hospital that you were born at had one of the top ranked NICU units in the area. So yeah, I was very happy with how the NICU took care of you. And they did say that, with premature babies, you have to go by what they call your adjusted age.
Right.
So even though you were born on December 13th, they were like, you don't really start counting until January 31st. So they said you're always going to be a little bit behind. And they said it would take you about 2 years to catch up. And that you would always
wasn't.
You were never behind. You did everything in the normal range.
Mm-hmm.
A little bit on the back end of the normal range, but you always did things on the normal scale. You crawled in the normal age range. You walked in the normal age range.
Potty trained early.
You talked early. Yeah, you did everything in what I consider the normal range. You had no lasting effects of being premature, which I'm so thankful for. You're taller than me. You're tall. You're not tiny.
Like average. You're just short.
Yeah. 5'5" is it average human height?
Yeah, I never looked preemie either.
No, you never had that gaunt preemie look about you that a lot of premature babies end up having.
Mm-hmm. And I didn't have any lasting health issues either throughout my life. Like a lot of preemies develop asthma or other complications throughout life. And I would say the only thing, and I don't even know if this has anything to do with being preemie, was my teeth my teeth never fell out, my baby teeth.
Well, you didn't even get your first tooth till you were 11 months old.
Okay,
which
so
is
my teeth were
delayed.
late.
Yeah.
Right, so everything about my teeth was delayed. I mean, I've had over 12 teeth pulled because the roots never went away. And so
No, your roots on your baby teeth were really long for
They
baby
were as
teeth.
long as adult teeth are supposed to be.
Yeah, they were
never...
they would have never come out.
She had rows of teeth because her adult teeth just decided to just come in behind her baby teeth. So she was a shark.
Yes.
And then I have really small ears that don't drain.
Tiny ears.
You have tiny features.
Yeah, I guess.
Like, you have a small mouth, you have small ears, you have like a tiny nose.
He did it tiny.
But I'm not tiny.
No, you're tall.
Yeah, right? To you.
So anyway, so that is what preeclampsia is and what preeclampsia does. And for our first child, experience was traumatic for me, and did not know a lot about what preeclampsia was, like I said, until like later we did some research.
So going into Morgan, did you have a better understanding of what preeclampsia was to talk to your doctors? Like, did you decide on a doctor because you had preeclampsia? Like, how did you go through that process?
So actually, again, I was young and naive and didn't know anything. And
did you just assume it was a one and done situation and it wouldn't happen again?
I think I did. Kind of just like, oh, that happened. It could never happen again. And when I was in the hospital, in the second hospital where you were born, and I had gotten really sick, I do think that this is kind of a God thing that it happened this way, because I didn't have a doctor. Mm-hmm. We didn't really have doctors coming and telling us what was happening, what was going on, explaining things to us.
Right, because the on-call doctor changes every however many hours.
Right, and so we were kind of kept in the dark about a lot of things. Well, it just so happened that my in-laws, Grammy and Poppy, Daddy's parents, had a friend that belonged to the same country club as they did, who is an OBGYN. And he would round at that hospital, and he happened to see my name on whatever, paperwork that he could see at the hospital, list of patients. And he recognized the name. And so he came by to see us, and Grammy and Poppy were there. So he actually would look at my chart, and he would tell them and keep them updated as to what was going on, which was funny because nobody was really talking to us. We were getting information kind of second and third hand. But he was so kind. The way he treated us and the way he treated our in-laws, I really liked him. So when I got pregnant with Morgan, I went to him as my doctor.
Mm.
And I think also too, he was a little bit more familiar with high risk pregnancies. He wasn't afraid to take on a patient that had preeclampsia. Mm-hmm. So I got pregnant with Morgan and had a normal pregnancy, with the minor detail of I was sick all the time.
So then what was like the biggest difference between your pregnancy with Luaranne and I then?
Were you more sick with me or Morgan?
I was more sick with Morgan because I was sick through the entire pregnancy, whereas with you, Luaranne, I was only sick pretty much the first trimester. And with Morgan, it wasn't just morning sickness, it was all day sickness. Like, it was horrible. And never felt good. but other than that, I wasn't swollen like I was with Luaranne.
Mm-hmm.
And towards the end of the pregnancy, though, I had a really hard time sleeping, and it was really uncomfortable. Now, again, when I was pregnant with you, Luaranne, I didn't get to that full pregnancy state where you're 9 months pregnant and you feel like crap and like, get this thing out of me. Whereas I did with Morgan, and it was not fun. I did not enjoy it. But so right before you were born, I had my regular doctor's appointment, and my blood pressure had started going up. I was starting to exhibit symptoms of preeclampsia again. And
so from what it sounds like, you didn't start exhibiting symptoms until very late in your pregnancies.
Right. Well,
which
that's
is
typical.
Okay.
According to the website that I looked at, typically you don't start exhibiting symptoms of preeclampsia until you're at least 20 weeks along. So it's usually towards the end of the pregnancy.
Okay, yeah, because 20 weeks is halfway.
Mm-hmm.
Right. 20 weeks is the halfway point. So I'm fortunate that with Luaranne, it didn't get serious until
32-ish.
I was right. Whereas with you were only 10 days early.
Yeah.
So as soon as I started exhibiting symptoms of the preeclampsia, they were like, well, why don't we just go ahead and induce you?
Because you were technically full term at that point.
I was
anyway.
full term, yeah. And I was really uncomfortable too to begin with.
Mm-hmm.
And so that, and then the beginning symptoms of preeclampsia, they were like, let's just go ahead and induce you. So you were born, like I said, you were only 10 days early. Normal delivery. I was induced, and so you were born pretty quickly. I was able to have that bonding time with you after you were born.
But you didn't even tell the best part.
What was the best part?
I flipped in the birth canal.
Oh yeah, Daddy likes to tell this story. So when
and her umbilical cord.
Yeah.
Yeah. So when I was delivering Morgan, every time I would push, her heart rate would drop a little bit. And I guess it had gotten to the point where you were really far down in the birth canal. And I remember all of a sudden being in the delivery room, and I noticed more and more people were coming into the room, like doctors and nurses. And Daddy was kind of slowly, but being kind of pushed away.
Because wasn't I also facing the wrong direction? When the baby's born, they're supposed to be face up. I was face down at first.
They're supposed to be face down.
Oh.
And you were face up. You don't want them face up, because if they're born face up, they can swallow the meconium fluid, and that's really bad.
Okay.
So a normal delivery, a baby is born head facing down, south.
Towards the floor, not south.
Towards the floor.
Yes.
Well, at one point I'm pushing, and a nurse comes up to me, and she grabs my hospital gown, and she's like, you have got to get this baby out now. And of course I started freaking out, and she's like, don't freak out, just you need to focus. So, and it was because, I found out after, it was because you had the umbilical cord wrapped around your neck twice. And so
the fact that you didn't know that the umbilical cord was wrapped around her neck before you started pushing, I mean, I guess they didn't know because
they didn't do an ultrasound. They didn't do an ultrasound right before she was born.
I know.
Do they normally, or do they just let you go?
They just let you go. And then my labor with you was very fast. It was only 5 hours.
Yeah.
Whereas Luaranne, you were 17 hours. So by the time, it happened quicker with you, Morgan. So I was already in the room pushing.
Mm-hmm.
And I guess I don't know the details. When you're in labor, you don't really care about anything other than getting this creature out of you. And frankly, you don't care what they have to do to make that happen, because you get to a point where it's really, really bad. And I had an epidural. They gave me an epidural with you. Actually, I had an epidural with both of you, but it didn't work with Luaranne. It did work with Morgan. So I wasn't in pain. And the epidural had taken effect so much so that I couldn't feel when it was time to push. They had to tell me, okay, push, when the contractions would come. So as I am pushing and you're coming out, you flipped, your head was out, and you turned over while you were still in the birth canal. And the doctor was like, whoa, did you see that? And he said that to Daddy, and Daddy was like, wow, yeah. So you came out, you weren't really breathing that well, so they had to like do all kinds of stuff to get you, you know, they tap on your chest and I don't know what they do. So you started crying and you were fine. And I did not have an episiotomy with you because this doctor was good and he knew what he was doing. And
didn't he also like massage?
Yeah, so there's a technique that doctors can do where they go in and they essentially they massage your cervix to stretch it so that it doesn't tear.
The idea of that happening.
Okay, but Luaranne, like I said, when you're pushing this creature out of your body, you really don't care what they have to do.
I know.
It's way better than it tearing because then they have to like sew it back together, and that's probably uncomfortable.
I know. I've had friends that have given birth to like 8+ pound babies, and they've torn from front to back. And
yeah,
like
you do not want to tear. If you can avoid tearing, you want to try and avoid that. And Morgan, you were 6 pounds 10 ounces, so you were small. You were perfect
that's
size.
Normal.
Well, nowadays that's considered small, I think.
Really?
Most on average, like the average birth weight of a baby is, I think, 7 pounds or more.
Yeah.
I don't know
7.5.
What is it?
7.5
is the average birth weight, and you
although 5.5 between 5.5 and 10 is normal as well, but the average is 7.5.
Lord help me if I have a 10-pound baby.
So you were definitely a normal, normal size, but not too big. And so I remember having you, and I'm in the hospital, and I have this really, really, really bad headache that will not go away. And they don't know why I have this headache, and the headache is getting really, really bad. And so they think that, they discovered that when, again, I was in this hospital that is a teaching hospital, I didn't know that you could insist on a attending physician or an actual MD to work on you. And when they gave me my epidural, the anesthesiologist let his resident do my epidural.
They didn't ask, like, I feel like most times I've gone to hospitals before, or I've gone to the doctor's office, and they make you sign a waiver, and they're like, would you be comfortable if a student did medical practices on you or whatever? Like when I had my stomach surgery a few years ago, they made me fill out a waiver that said, like, would you be okay with students being in the room or performing certain tasks? And I said no.
Because, no offense, but an epidural, you could paralyze somebody, could you not, if you do it wrong? Because it's right in your spinal cord that they're injecting this. So if they do it wrong, they could accidentally paralyze you. Like, to have like a medical student or a resident who doesn't have experience doing that is kind of dangerous, especially in a high-risk pregnancy like this.
I think when an anesthesiologist comes to give you an epidural, you have to sign paperwork.
Right.
I don't remember what I signed. And something that you should realize when they come to give you an epidural, you are in labor.
Yeah, so you're having contractions, and
you're having contractions, and you are in a lot of pain.
Mm-hmm.
And you want that pain to stop. And you know that the anesthesiologist is the only one who can do that. So you will sign whatever you need to sign to get that pain to stop.
Yeah. So I did some quick Googling, and I'm slightly correct. They can include you can get paralyzed from it, but it is extremely rare for that to happen. It is a possibility, but it's rare.
Because it's an IV, which I did not know.
Oh.
An epidural is not a shot. An epidural is an IV that they put in your back to administer the whatever medicine is in the epidural into your spine to paralyze you from wherever they inject it in your spine from that point down.
See, and I don't remember
we're all
that.
learning today.
I almost feel like mine was a shot, but
it may have changed over the years, but I know now it is an IV, and once you get an epidural, you also get a catheter because you can't go to the bathroom anymore.
Yes,
because
I did have a catheter with
you
both of
can't
you.
use your legs. You can't
Yes.
stand up, which is also why they don't let you change positions while giving birth if you have an epidural. So if you have an epidural, you're giving birth on your back. If you don't have an epidural, you can walk around, you can move, you can flip over, you can go to the tub or whatever. Like, that's a natural birth. But if you have an epidural, you have to stay in that one position because I think you have control over your legs, but because
no, you don't.
You can't feel. Oh, you don't. They lift your legs up.
Yeah, they have to hold your leg. I couldn't hold my legs.
Gotcha.
You don't feel anything.
Right. Well,
so
you can feel pressure, but you don't feel pain, right?
No, I didn't feel anything. They had to tell me when to push.
You couldn't feel the baby coming out?
Well, typically what they do is when they initially administer the epidural, it numbs you essentially from the waist down and you don't feel anything.
Right.
When it comes time, when you become fully dilated and it's getting time for you to push, usually what they do is they turn it off or they stop administering the drug that gives you the epidural.
Which is why it's an IV.
Right. So that you can feel the pressure. Right. You still don't feel your legs.
Okay.
Unless it wears off quicker. Mm-hmm. In my case, I could not feel my legs and I could not feel when it was time to push. They had to tell me when to push. But anyway, so the headache was a result of, it was a resident who gave me my epidural. And when they first gave me the epidural, it didn't work. Mm-hmm. So they had to go in again and do it. Well, I think at one point when they gave me the first shot, they punctured my spinal column. So when they give you the epidural, they just numb. I don't know how they do it, what the details of it, but you're not supposed to go into the spinal column. In my case, she did and punctured my spinal column. And I was leaking spinal fluid, which is what was causing the headaches. So
I'm sorry. It's kind of comical, all of these things. And it's not over yet.
No.
There's more.
They told me that the they call them spinal headaches. They told me that the spinal headaches will go away eventually on their own. Because it just takes time for that puncture to heal and close up. But it could take days, it could take weeks, it could take months. There's no way to know. And I was like, oh my gosh. They're like, we could do what's called a blood patch, where they take blood from you and they do another, quote, epidural, a shot into your spinal column where that hole is, to patch it with blood, because the blood will coagulates and creates like a patch over that
like a
hole.
Scab.
Right. And I was like, nope, I don't want you going back in there. You screwed it up the first time. Mm-hmm. So they tried a caffeine drip. So they gave me caffeine through the IV because caffeine speeds up coagulation. Huh. And it constricts the blood vessels. So it was supposed to have healed up the hole quicker. Mm-hmm. Mm-hmm. That did not work. So I was miserable. So Morgan was born on a Wednesday. On Friday, I was like, just let me go home. Just let me go home. Let me just send me home with drugs. I'll be fine. Mm-hmm. So they let me go home with Percocet, which is a painkiller. And I get home from the hospital on Friday and I go and I lay down. And I just need, just leave me alone. The headache was so bad I couldn't even see straight.
Do you think that now, I know you still get headaches to this day. Do you think that has anything to do with the fact that, I know technically it's healed now, but do you think that stems from, did you get chronic headaches before Morgan was born?
I've had headaches my entire life, or it feels like since my entire life, since I was young. So no.
I feel like you've just had a constant headache your entire life. And it just varies in degree of how bad it is.
Yeah.
It doesn't actually go away.
Since I was young, since I was a kid, I've had headaches. So they sent me home. I lay down. I take a nap. The Percocet, kind of knocks you out. I wake up after, I start feeling pain again. And I go to get up and I passed out. And that's when Dad was like, okay, we're not playing anymore. So they took me back to the hospital, and that's when they did the blood patch. And the blood patch worked immediately. I felt relief instantly. And so one thing about Morgan when she was born is she had a low bilirubin, which is your liver, something to do with your liver, and it causes jaundice in the babies, which is not good. It means your liver isn't working like it's supposed to.
It's when you go yellow.
Yeah, you turn yellow. You look like you have a permanent tan. You know,
I don't want to say tan. It looks like you're dipped in iodine almost.
A little bit, yeah. And if it goes untreated, then, you know, the baby gets lethargic. They don't want to eat, and it's just not fun. So when they sent her home from the hospital with me on Friday, they said, you know, stick her in front of a sunny window.
Like a plant?
Like a plant. Keep an eye on it. And if you notice that she starts to get lethargic, bring her back. And they said, but bring her back on Saturday and we'll draw blood and we'll check her bilirubin levels to see if they've gone down or if they've stayed the same or if they've gone up. So when I had the blood patch done, they told me at the hospital, they're like, now you need to rest in order for this to work. You need to go home and rest. I said, okay. So I go home. Friday night, I'm fine. Saturday morning, we get up and we've got to take Morgan back to the hospital to have her bilirubin checked. We go back to the hospital. That was an absolute nightmare because the way that they take the blood from a newborn is they bend their foot until the top of their toes are touching their shin, which you can do with a newborn baby because they're very flexible.
Right. Their bones aren't fused together yet.
But
it's
she
painful.
was screaming because they're trying to get blood. They draw the blood from the heel of your foot. Well, they couldn't get enough blood.
Oh.
So they kept having to do it over and over and over to get enough blood to test. And you were screaming. I was crying. Luaranne, I don't know why you were with us, why we didn't have you go to Grammy's house, but you were very concerned about your baby sister. It was just it was not a calm and relaxing day like I was supposed to have. Started getting a headache again. And the headache was really bad. And I thought that the headache was a result of the blood patch not working. Oh, and on top of this, I had developed a urinary tract infection from the catheter that they had given me when I was in labor with you.
Which is common with catheters.
So we had called the doctor's office for them to call in a prescription for the UTI. And when we called the doctor's office, they asked how I was doing. And Daddy was like, well, you know, she's got a headache again. And they're like, okay, well, you know, just keep an eye on it. And I remember sitting in the chair and I was taking the Percocet and the headache wasn't going away. And I didn't feel good. I just didn't feel good. And we came home from the hospital after having your bilirubin checked, and your numbers were a little bit higher, but they weren't really high. And they were like, well, just keep an eye on it. You know, if you notice that she's getting lethargic. So Saturday we had a bunch of family come over to see you because you were new. And I still
no offense, but I feel like that was probably the wrong move with having everyone come over and like after everything that just happened.
Well, at the time when we had said, yeah, come over.
You thought you were on the mend.
I thought I was on the mend. I didn't know that I was getting sicker. And it was as the day progressed that my headache progressed. And so I'm sitting on the chair and you weren't doing well. And Daddy was like, I'm taking her to the hospital because you weren't eating. You were very lethargic. You just weren't like a proper newborn should be. So Daddy got very nervous. And frankly, no offense, Morgan, but I had a really bad headache and I didn't really care. My headache was so bad. So Daddy took you to the hospital, and your Aunt Dawn and her boyfriend at the time, who's now her husband, stayed with me to keep an eye on Luaranne because I was really not feeling well. The plan was Daddy took you, because they ended up admitting you because your bilirubin had gone up and you did have jaundice. The plan was Daddy was going to stay with you that night, and then I was going to come Sunday morning to relieve Daddy so he could come home and take care of Luaranne.
Mm-hmm.
So Aunt Dawn and Uncle Tim ended up staying with us until about, I don't know, 2, 3 o'clock in the morning, it felt like. And then they finally went home because you were sleeping and I was passed out, I guess, from the Percocet. But the headache had not gone away. It was getting worse. It was getting worse. Sunday morning, my parents came over because they were going to sit with you, Luaranne, while I went to the hospital to relieve Daddy.
Right.
Grandpa, who was an EMT at the time, took one look at me and he's like, something is not right. Like, she does not look good at all. And I just kept saying, oh no, I have a headache. Maybe it's the UTI. I just need the headache. I just need to sleep. So Grandpa called Daddy and he's telling Daddy that Paula doesn't look good. Something's wrong. So Daddy called the doctor's office and he's like, something's not right. You know, the headache isn't going away. She's still, you know, whatever. So the doctor's office called the house and they put me on the phone and the doctor was like, okay, explain to me what you're feeling. And I was like, well, I just have this headache. It won't go away. And again, I'm thinking it's the blood patch didn't work and I just need, the headache just needs, like, the hole in my spinal column just needs to heal. And the doctors were like, well, I don't know. He says, it's very unusual that you would develop preeclampsia this far after giving birth. He said, but I think I want you to come into the office and let me check you. And I said to him, I said, okay. I said, well, you know, it's funny that you say that because after I had Luaranne, my symptoms got worse after she was born. And they were like, you know what? Why don't you just come straight to the ER? Don't go to the doctor's office. Just come straight to the hospital. We want to check you out. Well, sure enough, when I got to the hospital, my blood pressure was through the roof. I don't even remember what it was, but it was like
bad.
Super, super high. And they admitted me right away. And I was very sick. And so poor Dad, I'm on the floor. We were in the same hospital, Morgan. You were on one floor in the pediatric unit, and I was on another floor. And, you know, it was really stressful. I was very, very sick. It turns out that they diagnosed me with what is called HELP syndrome. And basically, HELP syndrome is a rare, and I had to Google this too because I didn't know what it was. It's a rare but serious condition that can happen when you're pregnant or right after you have your baby. And HELP, it's HELLP, stands for the different things that can happen to you when you have it. So your platelet count drops, your liver enzymes become elevated, I don't know what hemolysis is.
Hemolysis?
Right. Something to do with your red blood cells that they break down and they're not carrying oxygen like they're supposed to. And it's pretty bad because it mimics preeclampsia. And again, the cure for preeclampsia is to deliver the baby. But in this situation with HELP syndrome, you've already had the baby. There's really not anything that they can do for it other than to treat the symptoms. And they give you, it's called magnesium sulfate, and it's a drip that they give you through your IV. It is the worst thing in the world. I don't wish this on my worst enemy because it makes you feel like crap. And it's what helps keep your blood pressure down. It is, but it gives you a headache. So they come into you in the hospital room and they constantly, do you have a headache? Well, yeah, I have a headache, but I don't know if it's because of the HELP syndrome and the elevated blood pressure or if it's because of the magnesium sulfate. Like it's a nightmare. So I ended up being in the hospital for, I think, 48 hours until they got my symptoms under control. Morgan, you were discharged from the hospital. I was still in the hospital. Grammy and Poppy kind of took care of you. It was just an absolute nightmare. So after I had you, the doctors were like, we really don't think you should have any more children because apparently with each case, like if you have preeclampsia with your first child, your chances of getting it
increase every time you have a child.
Increase each time. So because I had it with both of you and then I had HELP syndrome on top of that, they were like, you really should not have any more children. So when you were about 3 months old, Daddy had a vasectomy. When I had preeclampsia with both of you, they told me that preeclampsia is hereditary and that they don't know what causes it. There's not really anything you can do to prevent it. But since then, now this is over 20 something years from now, I have heard that it is not hereditary. Mm-hmm. And that there are things that you can do. Diet plays a big part in how to prevent preeclampsia.
Didn't you have a friend that had like 3 children or whatever, and the first 3 she had preeclampsia and was getting really, really bad, and then the 4th one, while she was pregnant, she had this like super strict diet and didn't have it?
Yeah, she basically cut out all sugar, so basically did not eat any carbohydrates, cut out all sugar. And I want to say she did something else, but I don't remember. But I do remember her saying she cut out all sugar, and she did not get preeclampsia with the 4th. So those are my birth stories. I am very fortunate that both of you ended up being very healthy and happy, well-adjusted children. I am glad I did not have a third.
I don't know if you could have handled a third.
No. Daddy used to joke, because I always would say to him, are you disappointed that you never had a boy? And he says, well, frankly, I like having you around. Because the thing that was scary was with Morgan, when I started developing the symptoms of HELLP syndrome or preeclampsia, whatever you want to call it, I was already home from the hospital. Mm-hmm. And had my parents not been on it, had Daddy not been on it, I could have had a seizure at home and I could have died. Mm-hmm. So, we are very fortunate that I did have 2 healthy children. And so those are my birth stories.
I know Mom sharing her birth stories. As you know, Austin and I are trying to conceive. And we started trying in March. I was on birth control. I started birth control in October.
Yeah, like exactly 3 months before your wedding, probably.
Right, because they tell you need to start birth control usually 3 months before you start planning on having sex, because
you want to make sure
it needs time
in your
to
system.
It does.
Right.
Yeah, it takes time to get into your system and actually work.
Right. And so I started in October, and birth control did not make me feel good. I don't know. Birth control was not for me. And then I started another birth control in January because my periods were so bad before birth control, on birth control, during everything. It was awful. And then when I started this other birth control in January, it was like a 3-month birth control, and you don't have a period for 3 months. And then at the end of the 3 months, you can either choose to have a period or keep taking the birth control, and you can skip the period if you want. The problem was I was only on it January and February. I had spotting or some sort of period like 7 different times from January to the end of February. Also, remind you, Austin and I got married January 3rd. So we're newlyweds, and I've had like 7 periods in 2 months. It was awful. So I was like, forget this. I'm just not going to be on birth control anymore. And we had decided that we wanted to start trying anyway.
If it happens, it happens.
Right. So we started trying in March. In April, I did get pregnant. And I was pregnant for about a week and then had a miscarriage.
Well, you were probably pregnant you only knew you were pregnant.
I only knew I was pregnant for a week.
Because you probably were about
4 weeks.
Maybe 6 weeks pregnant.
No, I wasn't that far along because implantation hadn't occurred yet. So they called it was technically a chemical pregnancy, which is when the egg is fertilized, but it doesn't complete the implantation process in your uterus. Oh. And so I was probably only a week or 2 along at that point because it was an early term miscarriage. So when I went in for my ultrasound, because they wanted to kind of look at everything and make sure everything was okay, they did see that I had cysts on my ovaries. And the doctor had said that, okay, these look like polycystic ovarian cysts, PCOS. And so he said, let's keep an eye on it. We'll watch it, blah, 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 whatever. So I didn't have blood drawn or anything to check my hormone levels. But so PCOS stands for polycystic ovarian syndrome. And in order to be diagnosed with PCOS, you have to exhibit at least 2 symptoms. So whether that be you have cysts on your ovaries, and another really common symptom is you have very irregular cycles. Another one of the really common symptoms of PCOS, not only just cysts on your ovaries, but you also have really irregular cycles. So you ovulate, it says, I think typically 9 times or less in a year that you ovulate. Other symptoms include, anything that has to do with increased male hormones. So basically what PCOS is you have too much androgens in your system, which is the male sex hormone, and you have an insulin resistance. So because of that, that could include, you could exhibit like facial hair or hair in places where it shouldn't be. There's a ton of different symptoms that could coincide with PCOS. I have regular cycles, I believe. So I do have a cycle every month. The difference is what they call an ovulation, which is when your body still has a cycle, but you're not actually ovulating, which is weird and confusing. And so it's really hard to determine whether you're ovulating or not, because you have a cycle every month, but that doesn't mean you ovulated. Mm-hmm. I have been tracking my ovulation, and as far as I'm concerned, since March when we started trying, I have ovulated every month. So that's good. And again, I haven't gone in to test my hormone levels, because you need to go in to test your hormone levels to see if you have too much of the male sex hormone. So I don't really know. We'll find out more. I go back to the doctor in August, so hopefully we'll get some answers. Other symptoms, you could actually develop alopecia or male pattern baldness. Because
Really?
you have too much of the male sex hormone or testosterone in your body, it causes male pattern baldness. So a lot of women who have alopecia also have PCOS.
That's interesting.
Mm-hmm. It can also have a lot to do with your weight and weight gain and weight loss. Some women are super lean that have PCOS, and then some women are overweight because of PCOS. It's like both sides of the spectrum. Different symptoms cause different things. It also affects your thyroid, which I have hypothyroidism. It's not severe at all, but I do have it. And so it's just interesting, like all of these different symptoms, I've kind of been like, oh, okay, well, I have hypothyroidism. Now I have the cysts. I need to go get my testosterone levels checked to see if they're elevated or not, which I have a feeling that they are, but again, I won't know until I'm officially diagnosed. But that does kind of change the way Austin and I are trying. PCOS is the number 1 cause of infertility in women, and it is hereditary. So thankfully Morgan does not have it.
That we know of.
Yeah, that we know of. We've been trying now for 5 months. This is my 5th cycle in July, if you count the cycle where we did get pregnant. The good news is I was only trying for 2 months and did get pregnant. It just didn't embed into my uterine lining. So hopefully in August we'll get a few more tests done and some answers. We're taking it slow. We're not in a huge rush, but we are trying.
So do you know how it affects your fertility? As in, like, does it make it harder for you to get the egg fertilized? Or does it make it harder for the egg to actually, like, attach to the uterine lining?
So I think, and I don't know for sure, the cysts in the ovaries make it difficult for the eggs to move through the fallopian tube or to come out of your ovary. It also affects, I think it affects the quality of the eggs that come out of your ovaries. I don't know a ton about how the cysts affect the eggs and what happens.
So every time an egg is released, it creates a follicle.
Right.
And that follicle is what draws the egg into the fallopian tube.
Mm-hmm.
Well, what happens with PCOS, if I'm not mistaken, is that egg gets on the follicle, but then stays on that follicle, and it like crystallizes or hardens, and
that's what becomes the cyst.
And that's what becomes the cyst.
Right.
And then it creates a blockage for other eggs to get into the fallopian tube.
Mm-hmm. Which is also why most women who have PCOS don't ovulate regularly, because the egg never makes it through the fallopian tube, which then would cause your cycle to start, which would then cause the uterine lining to shed and all of that. So,
yeah. So hopefully, you can get pregnant with PCOS. Sometimes it's a little bit trickier, and sometimes it takes a little bit of science, but there are plenty of women who have been able to conceive naturally and carry to full term and have children. So we are hopeful and prayerful that Luaranne will be able to, because she really wants to have children.
Well, the other thing that's a good sign is that you were able to get like a fertilized egg within 2 months of trying.
Right.
And it wasn't even active trying of like calculating your ovulation days and, doing it that way. It was just more so just doing what y'all normally do. So that's a good sign, at least, that you can get, that it seems that you can get pregnant at that early.
Yeah. The doctor said that there was no increased risk for having a miscarriage. Again, I know that having PCOS does increase your chances of having a miscarriage. 1 in 4 women, regardless of their fertility level, 1 in 4 women have a miscarriage.
Oh yeah.
In their first trimester, at least.
Right. It's a lot more common than people think to have miscarriages.
Well, and and I had told Luaranne this when she miscarried, most women would have miscarried at the point that Luaranne miscarried and wouldn't have even known that they were pregnant, because
I was only a week late.
Right.
I wasn't.
And so a lot of people would have had a miscarriage and just thought it was their period coming.
Right.
And not even thought that they were pregnant. So.
Right. It's definitely affected my mental health, as far as like just, it's been hard.
Yeah.
Really hard.
But you have an amazing husband who is extremely supportive.
Very understanding.
Yeah, and he's with you through this, and it will happen. How it happens and when it happens remains to be seen, but you're very fortunate. You're early on in your journey, and you have plenty of time.
Oh, 100%.
Yep.
You're only 26 years old, and you've got plenty of time. It will happen. So, and Morgan, you are not wanting to have children right now.
No, we are going to be waiting for a little bit. So Andrew is very financially driven in how he plans things. And right now he doesn't feel that we can financially support a child, which I kind of agree. He's the main person making the money right now. My job doesn't make a lot at all. So we were trying to really wait until either he got a promotion and could make more or whatnot. Because a lot of people, especially in his career field, don't actually start having kids until their late 20s to early 30s, because their spouses have to have their career, they have their career, they have to be promoted to a specific rank, get paid a specific amount, because it's just not financially possible right now,
Mm-hmm.
especially because I'm basically making like part-time job money. He's making the actual salary of like, you know, an adult person.
Well, and you also wanted to not
The other
work.
reason is I don't want to work for a decent amount of time during, because I want to be able to, my dream is to be a stay-at-home mom. So there's that. And then not only that, but for a good while, I was not having the best mental health when it came to this. I was going to therapy, and I would say, not wrongfully, misdiagnosed with bipolar disorder. And I was horribly terrified about possibly passing that down onto my children and what it would do to them, or how their mental health would be affected by seeing me go through, you know, anything like that. And so I was just terrified in general that I was just going to mess this kid up, and that I was going to be a horrible parent and this, that, the other thing. That was my biggest fear, and it probably still is. Having kids is terrifying because you don't know what you do, if it's going to do good things or bad things. You never know how they're going to react to it, and it's kind of like it's a game of chance when it comes to raising kids, and you never know how you're going to react to it. You can say, I plan on doing all of these things this way and that way, and then you have a kid and all that goes out the window. So for me specifically, it's just been really figuring out how I feel and whether it's a good time or not. I know for a fact that I want to wait until I'm mentally stable enough to go through the process of trying to get pregnant, getting pregnant, and then having a baby, because I know that that's probably going to be really rough on me, especially if I have to.
Hormones during pregnancy, postpartum, it's a whole
and I know that I'm going to be really sensitive to not getting pregnant right away or anything like that. Like I just know myself in that, because knowing my mom, she got pregnant very easily. And then my husband's mother, my mother-in-law, she got pregnant off of 4 different birth controls. So, you know, they're both very, I guess you could say, fertile. And so like, I can't have that in my head. Like, oh, well, they did this, and so it's going to be really easy for us. I can't have that in my head. I have to. I know,
but not get pregnant 2 weeks after we got off birth control, like my mom.
Exactly. So I have to keep that in my head, that normal couples without fertility issues, it can take up to a year to actually conceive and have a baby. So I just have to keep that in mind.
Getting pregnant
is a miracle.
You only have a 30% chance every cycle to get pregnant. 30%.
Think about that.
Even if you're super fertile, 30%.
Yeah.
Like, that is insane. The fact that anyone gets pregnant is absolutely amazing.
Well, and like Morgan said, doctors don't even consider you to have fertility issues until you've been trying for a year.
Yeah.
And have not been able to conceive. So
yeah, the category is you have to have been having unprotected intercourse for at least 12 months in order to be categorized with any fertility issues. So even though I have PCOS, I'm not technically quote unquote infertile or anything until it's a year of us trying. And even because I had the miscarriage, I am fertile because we did get pregnant.
Right.
So yeah, I mean, just for anyone out there that is, you know, trying to get pregnant or is having those kinds of issues or those kinds of thoughts, just keep that in mind, that it will happen, and even if it doesn't, it's all part of the plan in the universe. You know, everything happens for a reason. You just gotta understand that it's gonna take some time. You just gotta have faith, I guess, in yourself. You can cut all of this out. I don't care.
Well,
I am just not good with words right now. My brain is not working at all.
I have friends who were never able to have children. And they are happy and they are well adjusted and they live very full lives.
They have their fur babies.
You do not have to have a child to feel fulfilled as a woman.
Yeah.
Exactly.
I have other friends who were never able to have children and adopted.
Yep.
And, you know, and again, have very full lives, and those adopted children are their children.
Mm-hmm.
So, the fact, if somebody is not able to conceive and give birth to a child, is not the end of the world. Is that something that you guys desire? Absolutely. But there's so many different ways to go about having children now. And there's so many avenues open to having children than there were years ago. So, it can happen, So if you are out there and you are trying, don't get discouraged. It can happen. And if it doesn't, then maybe
That's
it just
okay.
wasn't meant to be, and you can look at other avenues of having children. There are a lot of children out there that need homes, and maybe you're the home that could be for that child, or maybe you can look at leading a fulfilled life in some other way.
Mm-hmm.
So,
And if your parents keep asking for grandbabies, you can just snack them.
well, I wouldn't encourage that, but everyone has their own timeline. And I think it's not fair to expect someone to have a family based on your timeline.
Mm-hmm.
Morgan, you and Andrew have your own timeline, and we need to respect that you guys will have children when you're ready.
Yeah, we've been married for 4 years now, and I remember being asked about grandkids when we first got married, and it's still not happening yet. So we're on our own path, and we've got to figure that out for ourselves.
Yeah.
All right. Well, we are going to wrap this up for today. We thank you for joining us. And if you enjoyed our podcast, we'd love to have you join us each week. Thank you so much. And wherever you're listening, be sure to like, follow, and subscribe. And we would love it if you gave us a 5-star rating. You can find us on YouTube, Spotify, and Apple Podcasts. If you have any advice, questions, or topic ideas, please email us at bestfamilyontheblock@gmail.com. And we can't wait to see you next time.